We're here at the Florida Medical Cannabis Conference over at the Rosen Center Hotel in Orlando, and I have a great guest with us today, this morning. It's Dr. Terel Newton.
Hey.
How are you doing?
Great.
Good to see you.
Pleasure to see you.
If you don't know Dr. Newton, he is the new, or fairly new, medical director for Trulieve in the state of Florida. So welcome to your new position, and
Thank
welcome
you.
to Cannabis News Florida. So tell us a little bit about yourself and your involvement with cannabis, and what got you involved with Trulieve.
Yeah. So I'm a board certified anesthesiologist, and I'm fellowship trained in interventional pain management.
Mm-hmm.
And after completing my training in North Carolina, I did my pain fellowship at University of Vermont.
Nice, very nice.
And Vermont is an excellent, beautiful, wonderful state that's very progressive.
Mm-hmm.
And when I was there, they've had medical cannabis available since 2005.
They were one of the early adopters, right?
Early adopters, and with looking at the first 10 states that have passed medical marijuana laws, those states have had reduction in opioid-related deaths
Right.
in the order of 20 to 30% in the first few years.
Right.
So Vermont was included in that group.
Mm-hmm.
And I would say it's just tremendous how medical marijuana can be used as a tool for so many different medical specialties, not just anesthesia and pain management.
Right.
And once it passed here in Florida, I just tried to become heavily involved on the education side.
Right.
Connecting with other physicians, connecting on the community side, working with support groups, and really promote and help with education, help with updating ourselves on the research that's being
Sure.
done in the cannabis industry.
Well, you've landed with a great company. I mean, the company is a premium company in the state of Florida, at least, and expanded throughout the country. One of the, I guess, as I was telling somebody yesterday in an interview, Trulieve is one of those companies where the CEO had a dream, and the dream is coming true. There aren't that many.
Yeah.
There aren't that many companies that
That's true.
have
Yeah.
existed in this space where the CEO who started the company is still there.
Yes,
Normally
absolutely.
replaced during the move, or overlap with a major company on top of it. But Kim has been there from the very beginning and carried it forward, and has a mission and be able to carry it. Like I said, nobody has. I mean, they're twice as large as anybody else. in
Yeah,
the state.
Kim, she is laser focused on success. She is an excellent leader, and I think she's really driven by her heart, and she knows the benefit that the patients can get with this type of medication.
And and Kim is there. When an event takes place, a store opening, can't be at all of them, obviously. But when
Absolutely.
she's there. You can't say that a lot of CEOs. They kind of sit up higher, but she's down there with the people, meeting the patients. Don't call
Yes.
customers, meeting the patients.
Absolutely.
Day in and day out. So you got involved with this. What do you see as your role as the medical director? Because it's a big job, especially in the state of Florida.
Yeah, absolutely. Yeah, and according to Florida statutes, the goal and purpose of the medical director is to oversee the operations
Sure.
of the dispensary. And so a big part of that for me is making sure that our employees are up to date on education, on the requirements of the Office of Medical Marijuana
Sure.
Use. And as
those
well,
requirements change.
absolutely.
They do
Absolutely.
change. They do change.
And that's the wonderful thing about having like a leader like Kim. So we have people in place. We have a compliance
Sure.
team. We have a community educators.
Right.
We have a lot of support system, different vendors that help us meet those requirements. For our background checks
Sure.
and things like that. So it's wonderful working with this company.
Yeah.
Yeah.
So it was interesting when you were mentioning that it has other properties on it. Have you seen up what I would call up north in Vermont and that whole area that have adopted? Have you seen the cannabis being used as an exit drug from people that are addicted to heroin, cocaine, and that type of stuff? Have you seen that happening in the north a lot?
Yeah. So with my patient population in focus is pain management,
Right.
and patients dealing with pain are at high risk
Right.
of becoming addicted to not just opiates, like you said, cocaine,
Right.
and
Very easily too, and very easily.
what happens is if you're in severe pain and suffering, you want to escape your situation, you want
Right.
to escape your body, and this is what is one thing that pushes patients to addiction. So let's say we have a patient that's being weaned too quickly off
Right.
of their pain medicine, and if they don't have something to replace that, that pushes them.
Right. Pushes into a withdrawal situation.
Withdrawal symptoms, anxiety, depression. It can trigger worsening of post-traumatic stress disorder.
Right.
And so cannabis is something that can actually intervene to where someone does not even progress to trying those stronger drugs that will basically make them feel numb.
I have found, and I've talked to some people and interesting people that I involved with my healthcare side through addiction clinics.
Yes.
Some of them are now getting feedback from patients that they want to switch to medical marijuana to help them exit versus going on to another type of treatment. And I think some of these places are becoming somewhat surprised that their population is asking for another method.
Yeah.
And it's good to see, because we know this plant can help you balance your life.
And what makes it so amazing is that there's no known lethal dose of the medication.
Exactly right, exactly right.
And when you look at the versatility and the different components of the plant, that's why it has so many different uses and applications, to where it could be applied for addiction, where it could be applied for pain, anxiety, depression, insomnia, cancer, epilepsy, multiple sclerosis,
and I say more to come.
Parkinson's disease, ALS.
That's right. I mean,
and the list goes on and on.
The list goes on and on. But we don't even know what's going to happen as more research goes on in the next 2 or 3 years of what else it could do besides these others. It's got, in my opinion, it's trying to get, especially in the state of Florida, legislative understanding that this medicine can help many, not a few, but many, and you need to take what I would call the training wheels off of it to be able to have the population use it the way it should be used.
I think leaders, not only physicians, but councilmen, councilwomen, have an obligation to their constituents to be educated. And the reason that this trend is moving with such big momentum is because there's so many driving forces. So many driving forces. And even on the industry side, this brings jobs. It employs people, helps people take care of their family. So there's so many different applications and ways to approach the industry, even beyond the medical side, that it's really impressive. It's not like any other movement we've ever seen or ever will see.
No. It's an industry, as you said, it's not just using it as medication. The employee base to increase in some cities, especially where the grows are, to be able to get those people involved. It's an industry. It's agriculture.
Absolutely.
Well, I know we have to go into another session.
Okay.
I'm glad you were able to stop by.
Thank you.
And it's great seeing you, and look forward to having you in our meetings.
All right. Excellent. Look
Thank you,
forward to it.